Hi everyone, my name is Jingxian from Group 9. Our topic is current anthropology and health issues in society. And my group members is Wenli, Loshana, Chiyao, and Ismail. Table of contents. First will be the introduction, case study, conceptual framework, literature review, conclusion, and discussion. Introduction. Anthropology is the study of humans, examining cultural, social, and biological aspects. When applied to health issues in society, anthropologists explore how cultural practice, belief, and social structures impact health. This interdisciplinary approach provides insights for developing cultural sensitive strategies to address various health challenges within diverse communities. What is health anthropology? Health anthropology is a subfield of anthropology that focuses on the study of health, illness, and healthcare system from a cultural and social perspective. Anthropologists in this field examine how cultural, social, economic, political, and environmental factors influence health belief, practice, and outcomes within different communities and societies. What is HIV and AIDS? HIV is a virus that attacks the immune system, compromising the body's ability to fight off infections. AIDS is the final stage of HIV infection, characterized by severe immune system damage, making individuals susceptible to infection and cancers. Objective of the case. Cultural impact. Investigate how cultural belief affects HIV prevention, testing, and treatment in the community. Healthcare accessibility. Assess healthcare access for HIV services, identify barriers, and propose interventions for improved accessibility. Social dynamics. Analyze HIV's impact on family, community, and societal structures, focusing on change in support networks and resilience. Community-based prevention. Develop, implement, and evaluate culturally tailored, community-based HIV/AIDS prevention programs.
Next, I'll talk about case study of HIV/AIDS. The global situation regarding HIV reflects significant challenges and disparities. So the data below is from WHO. Infections and disease. Approximately 85.6 million people have been infected with HIV, and about 40.4 million have lost their life to the virus. Current cases. Globally, 39 million people were living with HIV, with an estimated 0.7 of adults ages 15 to 49 worldwide living with the virus. Regional disparities. The WHO African region is disproportionately affected, with nearly 1 in every 25 adults living with HIV. About mortality, in 2022, 6.3 million people died globally from HIV-related illness and preventive efforts. In 2018, 19 low and middle-income countries reported a total of 190 million people tested and received results, reflecting efforts in HIV prevention and awareness. So the table is showing the summary of global HIV epidemic in 2022. Conceptual framework, health stigma and discrimination framework. And this framework emphasizes the importance of addressing stigmas and discrimination as critical factors in promoting effective HIV/AIDS prevention, treatment, and help and care. Next, the structural violence is the concept of framework for understanding the social and economic factors that contribute to the spread and impact of HIV/AIDS. Particularly in Africa, this framework highlights the roles and social inequalities, poverty, and systemic factors in shaping health outcomes and access to healthcare. Next, aging, health, and quality of life. So this perspective recognizes the unique challenges faced by older individuals and the needs of tailored healthcare approaches. And syndemics, it emphasizes the interconnectedness of disease and the importance of addressing social determinants of health to effectively combat HIV/AIDS. Next one, cultural approach to prevention and care. This framework emphasizes the needs for cultural sensitive interventions that consider local context and community engagement. And the last one, health communication and promotion. This framework highlights the importance of tailored messaging, communities engagement, and addressing social and cultural barriers to communication. Next,
Now I'm going to talk about the literature review. The first one is the absence of transmission through ordinary contact. Dispel common misconceptions by emphasizing that HIV cannot be transmitted through ordinary day-to-day contact, reassures that the public that activities like kissing, hugging, shaking hands, and sharing personal objects, food or water do not pose a risk of HIV transmission. The second one is undetectable viral load and prevention. WHO underscores that individuals with HIV who are on antiretroviral therapy, which is also known as ART, and maintain an undetectable viral load do not transmit HIV to their sexual partner. Highlights the significance of early access to ART and continuous treatment support for improving the health of individuals with HIV and preventing transmission. The third one is WHO's landmark guideline. These guidelines serve as the cornerstone of evidence-based management of AHD globally. Besides, it also emphasizes the need for a comprehensive package of care to reduce morbidity, mortality, and healthcare costs associated with AHD.
The fourth one is society roles and the effect of stigma. A study by Contomanoulis regarding the public stigma of HIV/AIDS revealed the pervasive social attitudes and stereotypes that continue to surround this health condition. Stigma remains a significant barrier to effective HIV prevention, treatment, and support. Studies consistently highlight the association between HIV/AIDS and negative societal perception. Individuals living with HIV often face discrimination, judgment, and social exclusion. This stigma can manifest at various levels, including interpersonal interaction, healthcare settings, and within broader societal structure. The last one is global epidemiology of HIV/AIDS. A study by Govender provides a comprehensive understanding of the virus prevalence, transmission patterns, and associated factors. As of 2019, an estimated of 36.9 million cases, which correspond of 0.5% of the world's population, are living with HIV, with the sub-Saharan Africa bearing the highest burden. Sub-Saharan Africans remain disproportionately affected, with high prevalence in certain demographics such as Africa and Southeast Asia. In contrast, other regions are affected specific different abuse and development.
Okay, so next will be conclusion. The global HIV epidemic with 85.6 million infections and 40.4 million deaths faces significant challenges, particularly in the WHO African region. In 2022, 630,000 lives were lost to HIV-related illnesses. While prevention and awareness initiatives show progress, addressing the complexity of HIV/AIDS requires anthropological frameworks. The Health Stigma and Discrimination Framework underscores the impact of stigma on treatment adherence. Syndemics explores social determinants, and structural violence addresses systemic issues, especially in Africa. Cultural perspective emphasizes local beliefs, and attention to older individuals with HIV/AIDS is crucial. UN/AIDS stresses the importance of health promotion tactics to foster community involvement. Overall, a comprehensive global strategy informed by anthropological principles is essential for culturally aware and effective prevention, treatment, and care, ensuring equitable healthcare access for all. So next will be the discussion questions. These are some of the questions that we asked. So why do some people with HIV face more health problems as they get older, and how can we help them better? Another question is, what are some new and better ways to share information about HIV so that more people can learn about them and protect themselves? Another thing is, what are things in society like poverty and inequality that can make HIV spread faster? Another question is, how can we make sure that everyone, no matter where they live, has access to the same level of healthcare for HIV? And the last one is, why is it important to understand and respect the beliefs and practices of different communities when preventing and treating HIV? So next will be our references. And that is all from our group. Thank you.